Good morning. Today is January 20th, 1993. We're in the Biomed Communication Center of the Gibson D. Lewis Health Science Library at the University of North Texas Health Science Center at Fort Worth. I'm very pleased to have Dr. Benjamin L. Cohen, who's Executive Dean and Vice President of Health Administration, with us today. And we're going to discuss in just a minute the Health Science Center transformation. Give you a little background on Dr. Cohen. He graduated from the Health Sciences Center at Kansas City in 1960, had a very distinguished career both in the private and academic sectors, as well as a number of published works. And he came here in 1990 in January, and again is now the Executive Dean and one of the Vice Presidents. Dr. Cohen, thanks for coming this morning. I'm Blake Hailey, and Dr. Cohen, we would like to start, if we could, if you'd like, we can go back from the time that you graduated up for a little background to date, if you'd like, and kind of go into how the Health Science Center idea was created here for TCOM.
Well, thank you, Blake. I appreciate the opportunity of sitting with you and discussing the Health Science Center. Relative to my own background, when I graduated medical school, I took a pediatric residency in Dayton, Ohio, and then assumed the practice in Columbus, Ohio. And during the time that I was in pediatric practice, I became a member of the faculty of Ohio State University College of Medicine and taught at the Children's Hospital. The more I was involved in teaching, the more I liked it, and the more I was involved in department administration, the more I gravitated towards trying to make medical school a career. And then when the opportunity came in 1977, I left Columbus to become the dean at the University of Medicine and Dentistry of New Jersey of their School of Osteopathic Medicine. I was there for close to 8 years in that capacity, and during the process of trying to get a gift for the university, which I ultimately was successful in terms of being able to get a gift that valued about $1 million for the university to buy land to build its new campus. I left, however, shortly after to join the company that gave the gift, and headed that company's efforts in medical facility development for 6 years, an effort that took me all across the United States to varying medical schools and health science centers, and to Europe, where we worked with some of the institutions who were enlarging the scope of their campus and hospitals. It was a wonderful experience, but one in which I used to leave on Monday and get back on Friday night, and I really missed academic medicine. And 6 years later, when the opportunity opened up at this campus, when they were searching for a dean, I thought it would be a wonderful place to come and visit, and once I did, I saw the enormous opportunities on this campus, and was appreciative that I was offered a position.
Well, how did I know it's good to get back into the academic world, especially traveling like that. It wouldn't be a lot of fun. How did the idea to become a health science center from out of TCOM start? Was the idea you had when you first got here, or was someone else helping you work on it? How did that all come about?
Well, there's no question that the Health Science Center idea had been alive and well for many years, and during the process of the interview, there was discussion that one day we might be a health science center, and I think There were individuals, including the chancellor, who felt that that was somewhat in the distant future and something that would be advantageous to work for. I know the president, Dr. Dave Richards, had for several years tried to open up the doors of this campus to community leaders, and had made a concerted effort to have the community understand what TCOM was and what the desires were for the future. And so it was part of a discussion when I initially came to campus.
Who was the chancellor at that time?
Dr. Al Hurley.
Okay. So in a sense, then, this is almost a necessity to become a health science center. Do you think that TCOM would have or could stand on its own over time?
Well, when I arrived and started to work and noted that all of the other medical schools in the state that were state supported were, with the exception of Texas A&M, designated health science centers, and that Texas A&M likewise professed the desire to do so and had asked their board to make a change in status. It is apparent that the designation of a health science center broadens the scope from just a single focus of a medical school to a multiple focus of other healthcare professional training that in today's age of medicine is part and parcel of a team effort to care for both the patient and the community.
Well, were you aware of, were there other attempts as far as trying to make us a health science center, say before A&M or at any other point? Or was this, like say, just after you
I had
arrived?
heard that years ago there were some signs put up designating it as a health science center, but that it really wasn't a legislative enactment, and it was really more name than in function. So when that was put up, there were several individuals in the community who didn't understand it, and they had to change the signs back to the Texas College of Osteopathic Medicine.
Okay, so when you did in the early part of the decade, of the 90s, then you had ideas of other schools and other types of programs to add, not just a name change. You had all kinds of plans envisioned, I'm assuming.
Yeah, we did.
Right.
The administrative team, yes.
Okay. Now in 1983, which is probably after the time you're talking about the signs that were posted, North Texas State wanted to put a master's degree in public health. Did that have any impact on today's plan as far as the health science center goes, or was that just something that they were working on at that time and doesn't affect us now?
Well, I think it's a completely different approach. At that time, there was consideration to put a program up, and to the best of my knowledge, it may have been too premature for the institution to try to foster. Certainly times have changed, and the approach has changed. Public health is a far more important segment of medicine today, and certainly has a greater depth of responsibility than there was in 1983. And our faculty is enlarged, and the way we have planned this with joint appointments would give us the kind of in-depth faculty that could provide a sound program for the approach of a Master of Public Health.
So that's kind of one of the programs you're considering and adding then along?
Yes.
Is the Health Science Center, the plan for the Health Science Center, the programs you want to add and so forth, is that already in the 6-year plan? You kind of have it all mapped out more or less? I know things can change.
Well, we're in the process now of creating a new strategic plan. And in that strategic plan, there will be an inclusion of not only the Master of Public Health program, but the desire to make a doctorate in public health, the desire to make a school for public health, a school for allied health, and we are considering other programs as well.
Okay. What about some of the key people that were involved at that in the early stages of this? Perhaps some people that were somewhat influential, so on?
Well, I think there's a definite team that is functioning with the Board of Regents taking leadership, and the Chancellor and President Dave Richards, and then our team, which would involve the participation of the Associate Deans, Dr. Gracie and Urio and Dr. Mills. And we've recently brought on board Dr. Linda Neeson, who will be the Executive Director of the Public Health Program. Dr. Dan Snyder was one of the early individuals who was instrumental in bringing a new kind of development, health assurance development, to the public health forefront. So and Dr. Warren Anderson, who heads our academic and strategic planning unit. So there's a well-functioning team that has worked with faculty and staff to develop these programs.
What are some events that come to mind as far as milestones in the past and maybe that are coming up of significance for the Health Science Center, and how do you feel that your role has been up to this point?
Well, I think historically the medical school had and has as its primary mission the production of primary care physicians. Our graduates go into primary care at a higher percentage rate than any other medical school in the state of Texas, and we most likely rank within the top 5 in the country. We're very proud of that record, and that's a record that has not only historically been true, but one that continues and hopefully will remain that way in the near future. This has occurred along with the changes that are occurring by natural forces in the healthcare reform. And as you know, this country is every day debating what it should do with its healthcare delivery. The question for the country is the enormous cost of our medical healthcare system that currently is $850 billion a year and will be $1 trillion by the time 1995 comes about. And there's enormous concern both at the citizens level, at the congressional level, at the state level, about trying to alter the system so that we could make it affordable for all citizens. There are 39 million people in this country who do not have any insurance. And in the last 2 years, 2 million people have lost their job and lost their insurance and have not recovered this. So that we are somehow or other caught up in the vortex of trying to reestablish a system that would make more sense. And as you look at the rest of the civilized world, what you see is that in all the other countries, by far the majority of physicians are primary care physicians. They make the best gatekeepers, and they practice the most cost-efficient medicine. So in this country, the figures are the opposite. 70% of our physicians are specialists, and 30% are primary care. And one of the big features of healthcare reform will be the attempt to change the national statistics so that more physicians who graduate go into primary care. Our record puts us in front of the pack. Our record puts us at a time in history where we are producing the kind of physician to meet the greatest needs. And so I see this as a very important facet of what we do as an institution. Public health is really the program, unlike medicine, where the patient and the doctor have a single relationship, or the patient and the doctor's team have a relationship. In public health, the community is the patient. And the reality of life is that over 60 to 70% of the illnesses we treat can probably be prevented. And how do we prevent them? And that is the major job of public health, to understand what diseases and illnesses there are on a community basis, to work with the community, work with the teachers, work with facets of society that will change behavior patterns and help us enjoy a longer and healthier and happier life. And that's why public health is going to be the star of the next century's medicine.
And you mentioned also another school, I think, of allied health. Could you go into a little bit of that one?
Yes, we're currently taking a look at the needs assessment. There are many technical jobs in healthcare, because healthcare is a huge industry, as you might imagine, because of the dollars spent. It is one of the largest industries in the United States. There is still a crying need for certain people in the workforce who have certain skills. Technicians who take x-rays, laboratory technicians who run blood tests, cytotechnicians who read certain kind of slides for doctors, therapists who help in the hospital giving respiratory therapy. And I could go on with a number of jobs that are very well-paying jobs that run the gamut from $35,000 to $70,000 a year, that are unfilled because we don't have enough trained people in that area. And North Texas has a particular shortage. We're very pleased when the president announced to us that the president of the Dallas-Fort Worth Hospital Council, John Gavris, that's an 82-member council, has agreed to chair a steering committee to look at the allied health needs and what our institution can do about it.
Do you think a lot of these schools are going to have to be kind of put on hold for the health plan that you're talking about to go into effect, or can you start working on them, keep working on them as you're doing?
Well, we could keep working on it because it really takes years to develop a school. And, first you have to put a team together that assesses the needs, and then you have to develop a curriculum and hire the faculty and get accreditation and approval. And the approval must be given by not only accrediting agencies, but the coordinating board of the state. And that is a very complicated process, and it does take years in development.
Well, how many, off the top of your head I may be asking this, but how many people do we have graduating a year from the Health Science Center?
Well, we currently have the medical school graduates, and they run about 90 a year that graduate, and then there are, from the graduate school, a PhD and masters, there'll be 10 to 15 initially, and then that'll go to 20 and then 30.
And the vast majority of these individuals go into the primary care that you're talking about, a large percentage of them then?
The physicians do, yes.
The physicians, okay. At the Health Science Center unveiling, or the announcement in Denton about a year ago on November 12th of '92, there were about 5 or so groups proposed to do different kinds of linkages between faculty and so on and so forth. I'm wondering if you could give me the status on that, if there is anything, or how that all comes together.
Yes, we are working very closely with the University of North Texas in linking together those common interests and those resources that the university has with the resources that we have to common programming. And so we have task forces that are working together, made up of faculty and administration, both at the University of North Texas and here. Examples are in the public health, our executive committee. There are 4 members who sit on the executive committee who are from the University of North Texas. And then there are 5 or 6 curriculum task forces that are made up of both faculty at the University of North Texas and our institution. We also have task force working together on computing. We have a task force working together on resources. We have task forces working together on minority recruitment, so that the institutions do work hand in hand.
I know that's one of the things y'all are definitely trying to achieve, and it sounds like then you're well on the way to making that happen. How does this Health Science Center at this point different, or if maybe in the future, how do you see this being a different possibly from the other health science centers in Texas?
Well, first of all, as I mentioned before, primary care being a product that we are very proud of, I think is the core of what we will want to do. And the programs that will be related to that in public health and in allied health will meet the needs of the community. We want to extend both to the urban area and to, which is inner city, and to the rural areas. And in terms of linkages to inner city, we began a historic consortium, which is called the Tarrant County Medical Education Consortium. And it is made up of John Peter Smith, Harris Hospital, Southwest Medical School for their family medicine program, University of North Texas, our institution, and additional hospitals will be brought into the fold, such as the Osteopathic Medical Center. And ultimately all of the postgraduate medical training will be under this umbrella of the consortium. And this consortium will play a vital role in giving care here in the inner city to those that need it most in a working collaborative arrangement. In addition to that, we have an Office of Rural Medicine, and we are currently working with several communities to extend the arm of the university into rural areas and to meet those underserved areas. We think that the mark of this Health Science Center will be the dedication to service in primary care, and that the growth and development of our new postgraduate programs will be in primary care, and that will be a linkage to the public health school, the proposed public health school, where prevention and working with the community would be a key.
There were some, I'm sure, and probably still are some political effects to becoming a health science center. Can you maybe go back and explain a little of that situation? I mean, as far as dealing with the legislature and other people outside of the academic circles, maybe in the county even, and so on?
Well, there's no question that becoming a health science center opens the doors to the community understanding that the scope and the breadth of the institution is much wider than just training physicians, although just training physicians is an enormous job into itself. In order for us to accomplish this, we just couldn't declare ourselves a health science center. What we really had to do was to present a plan, to have that plan approved by the Chancellor and then by the Board of Regents. And once that plan was approved by the Board of Regents, we had to get two other very important approvals. By far, the major approval was to get legislation to grant us the authority to do that. And we were very thankful that the Tarrant County delegation was foursquare in our corner. And in particular, on the Senate side, Senator Mike Moncrief was extremely helpful as they guided the legislation through and enabled us to receive the designation. Once they did that, the coordinating board certainly approved our programs, and we moved forward. But that legislative support for us was a necessity, and for them to understand what we wanted to do and how we wanted to do it.
Were there any other effects as far as, say, on a local level with, say, officials in the city of Fort Worth or the council of the county and that type of thing, as far as getting noticed?
Well, we certainly kept them abreast, and the Tarrant County commissioners have certainly been kept abreast of our new relationship relative to the Tarrant County Medical Education Consortium. The mayor has been informed, and as a matter of fact, we look forward in January. The mayor is going to visit us, and that'll be the first time that we've had a mayoral visit since becoming a health science center. And so we try to work very closely with all of the county and city and state officials. Of course, we rely upon their help in trying to process through our funding and the understanding of our goals.
You also mentioned a few minutes ago about the accreditation of the school, the board that deals with that.
Yes.
Is that, I have in my studies on this looked at the acronym SACS, S-A-C-S, I believe.
Yes.
Is that who the coordinating board is, and could you tell a little about that?
No, the coordinating board is a arm of the state that coordinates all educational programs. There's a chancellor for higher education in the state, Chancellor Ashworth, and the coordinating board coordinates all of higher education programs and curriculum. And those appointments to the coordinating board are made by the governor. Accreditation, each school has separate accreditation. The AOA accreditates us as a medical school. But the Southern Association for Accreditation, the SACS, is an overall accrediting body for institutions of higher learning. And we are currently in the process of seeking accreditation because of our expanded activities beyond that of medical school. And we're in the process of doing self-study and in the process of filling out all the required papers and getting site visited. We anticipate that accreditation sometime next year if we're successful.
So that's probably the hardest thing to achieve then, it sounds like, is getting to become recognized by this group, it sounds like.
Yes, and now that we're a health science center, we have the opportunity to apply. Before, as a medical school, we didn't. So because of our increased responsibilities, and we're happy to participate in that accreditation process.
What were some of the financial and administrative concerns that you had when the Health Science Center was being worked on, and might as well, as far as in the future, I guess we could start as far as back when you came here and started working on this.
Well, we have a continuing concern about funding, and because we are a primary care medical school, our faculty practice earnings are not as great as other institutions that have tertiary kinds of care. And so therefore we have a greater reliance on the state for funding. And because of that, we have a lower faculty-student ratio. And so for us, it's a constant thriving to increase state funding so we can increase the number of faculty. Our dilemma about going to a health science center was we wanted to be sure that it wouldn't impact on the already very thin funding we have relative to the faculty numbers in the medical school.
So you have to, so there is a linkage in between the two very much, and so you're always having to watch that then.
Yes, and in new programs, we have to get external funding for the first few years when we first are trying to get the program up and mounted prior to the state approval.
Now once that happens, is it about 60% of the funding comes from the state and 40% would come from other sources? Or is it pretty much all from the state that we would get funding?
Well, it's 60-40, and that ratio probably someday will change to 50-50. And
also it'll start dropping here in a while.
Yes,
That's
yes.
not probably what you want to know about then.
No.
The relationship between the two faculties, from what I'm gathering from you at this point with UNT and, well, what was TCOM, seems to be in a pretty good relationship, I'm gathering. Or was
That's
it
correct, yes. Unfortunately, separated by 35 or 40 miles, and that's the geographic separation, always presents logistic problems. We are hoping that someday we'll have interactive TV, be able to link up both institutions for not only meetings but educational purposes.
So that was a bit of a concern when we became Health Science Center, was again the distance, just the same as it was probably when UNT acquired TCOM.
Yes, but we think that the site and location for all of the health science programs will be at this campus. We'll have linkages, hopefully by interactive TV, to some programs up there, and we certainly would welcome UNT faculty to participate down here, but the site of the public health school and allied health school programs will be at the Fort Worth campus.
And you have a number of faculty, as it is, probably coming from North Texas, along with some local folks.
We have some, yes.
You've mentioned the School of Public Health and the Allied Health as far as goals for the future of the Health Science Center. Do you envision any other programs?
Well, it could be. We've been asked by Association of Retail Pharmacy Stores to consider a pharmacy school, and we've been asked by Podiatry Association to consider a podiatry school. And while I'm not sure that they're currently high on the list, they certainly will in the future take a look at the needs assessment in the area and look at the possibilities of later, further on, maybe in the next decade, looking at whether or not we should bring those schools onto the line.
Now, the overall big picture, I'm curious to see, as far as the future goes, how do you see your role as being? That's probably the question you didn't want me to ask, but I'm curious to see what you feel your role to be in this great future that the Health Science Center appears to have.
Well, I want to be sure that I can continue to serve the president and the institution I believe that this institution will thrive because of what position we are in currently, and I would hope I can be a part of the exciting future. This is teamwork. There's not one individual, but many who support the team, and it's a very exciting place to work, and look at the challenges in front of us.
Well, Dr. Cohen, are there any things that you would like to bring up that maybe I have neglected in all of this?
I think you've done a superb job, and I'm pleased that we're starting to put on tape those individuals who were here at this time in the institution's life, so that someday when history makes a judgment of this institution, they'll have an opportunity to go back into the files and meet the many people who have played some part in the teamwork.
I have a feeling from what I've gathered here today and in my review of all the material up to date that history is definitely going to judge the Health Science Center at UNT, a very good program, and will definitely be top in its field down the way.
Thank you.
Dr. Cohen, I do appreciate your time and to come down today. We look forward to doing some other interviews, maybe with yourself or other people, as we continue on with the process of the Health Science Center into history. And again, I thank you very much, and I hope you have a pleasant day.
Thank you. Appreciate it.